COVID-19 task force. Today, we're going to talk a little bit about public spaces, town density. I'm going to recap, I was going to recap what we've done to date, but I'm going to recap what some highlights of the meeting yesterday, the select board meeting. And obviously, some major changes in the governor's decrees have opened up indoor dining, so public spaces will be a different conversation than what I had expected. So there are no minutes, so I will go into last night. Just going to go briefly through what I presented and what was how they took action on those items. Fishing from the bridge, there's no change. There was no need to have a vote because fishing on the bridge is allowed and nothing changes there, and our recommendation was not to change anything. One-way pedestrian traffic on the bridge did not get voted on, so they're not taking any action on that recommendation, which is fine. They asked us to continue to look at it. The more I hear from the public, it's becoming more of a contentious issue, and not actually contentious, probably not the right word, but it's disparate thought. And so it gets more complicated than what I thought. Just recently, within minutes prior to this meeting, there was a suggestion that the town put some road bumps in prior to entering for vehicles prior to entering the bridge and exiting the bridge to slow traffic down. The whole point of the bridge one-way traffic was to not so much to mediate COVID spread, but to hopefully not have people jumping into the street to avoid other people and then getting slammed by a motorized vehicle. And that was, I think, our point. So I think we leave that one with the town manager, unless anyone feels strongly that we should consider it. I did bring up the discussion point on public spaces based on the chamber's survey, and that there was not a great interest in using public spaces. I guess that was surprising to some of the select board members, but that is what it is. Now with the change in the governor's decree here on dining and indoor dining, I think that further takes spaces off the table, public spaces off the table. So I don't know. I think we should still discuss it, and I've put on the minutes that Alice can go through what she has surveyed her part of the business community. I did make a point of wanting to talk about keeping outdoor dining as an opportunity, which I think everybody on the select board continues to believe that we should continue that based on the original recommendation and then their approval through the summer and into the fall. That gives obviously guests and patrons an opportunity to make a choice from a safety standpoint, and then also opens up space that's taken away by the protocols of indoor dining. Pam.
Yeah, I have a quick question on that in terms of the outdoor space. I think we should have indoor and outdoor space, obviously giving people the option to eat indoors or if they feel safer outdoors. I don't know, and I've not seen any minutes published from any of the select board meetings in quite a while. I thought they actually voted to continue outdoor eating or to allow it through October, provided that it did not exceed the number of allowable seats. So, and I don't remember hearing them talk about that last night, whether there was an actual vote.
Yeah, it did not get discussed in that granularity. And I had intended to just reiterate the October endpoint and the fact that capacity would not change, but other things took priority. We had conversations around marginal way, which I did not bring to the table, but did come up from the public. Marginal way mask usage is now required, and they asked us to take a look and see how it's going and if there's anything else we can do. I'm not sure there is, but we still have a choice about direction and those kind of things. And maybe later Terry Ann can talk about what Joan's team is doing in terms of collecting compliance data with the people who are out there checking for mask usage. Mask usage was the big issue around the marginal way last night. So I will, we can talk about that as we go through the tonight's meeting if people choose to do that. So that was pretty much last night's select board meeting. Let's, if there's any concerns or questions or comments, please go ahead. There's Buzzy, you were first, and then Pam.
I was just, as to speaking towards dictating ways of traveling down Beach Street, I didn't realize we had made a decision, or even, because I don't think we should be doing anything. I think we should be getting out of the way of that. And I think any micromanaging of one way to the beach is going to be antithetical to the problem that's at hand. First of all, the beach has two different, the inlets coming down Beach Street. One side of the sidewalk is way bigger, has a bike path and a sidewalk. So in the morning, I would assume that'd be the freight train of people going to the beach, the big side. Those who are early morning beach peepers go up the skinny side. Reverse. At the end of the day, the heavy side should be the one people go. Like, it's been this way forever. And I don't think that, like, trying to micromanage traffic flow at any level, especially at that, is going to help us. I mean, I can see your concern, Bob. You've never really been here in the summertime when you should see how crazy that beach gets. People skateboarding, jumping curbs, jumping off the bridge, jumping over baby carriages. It's a live wire. So it's never mind bumper to bumper traffic, bikers sliding by, scooters flying by. There's a lot of stuff goes on. So I think until we see a need or a big problem, I think we should just stick to the rudimentaries of mask and social distance and hand washing in signs, that's it. I just didn't know we had made a decision that we should affect that, because I don't think we should. And if we did, I'm voting in the minority on that. Thank you.
Well, to my recollection, it was brought to us via some select board members, and we discussed it, and there was direction to go and propose it as a potential for the town manager to see if it was feasible. And so that's where we discussed it in two separate meetings based on my notes. But be that as it may, we're not going to pick it up any further. And I appreciate your comments about, how kind of crazy it gets here, because I don't have that experience. And so I have no idea about that. And so in some sense, it's my July 4th fireworks that Alice, said, why can't we have fireworks, right, Alice? And
I don't mean that as a critique. I just mean that as
that's good.
Seeing the full effect as other people could be. That's it. And all right.
No problem. It's not a critique, Buzzy. It's we all have our level of experience here, and we all bring something to the table. So I think the bridge issue can be better handled by the town manager and taking some of the feedback from the public. So good discourse there. All right, let's turn it over to the business subgroup and Alice to see if there's. Alice, are you in your new house?
No, actually, I'm in New Hampshire. I came over for my youngest son's 21st birthday, so we took him out to dinner last night. And I can travel back to Maine now because I'm in New Hampshire. So yeah, so this is his dad's house in New Hampshire. I am in you guys will see that next week, or whenever we next meet. So specifically, I think with the business subgroup, we did not meet since the last meeting. We were kind of waiting on the chamber survey results, which we organized on Friday. And basically, I think a couple of things. The survey dropped probably right when businesses were really starting to scramble to reopen. So I think the timing has been, and I've noticed with our weekly chamber chats, that the number of attendees is dropping a little bit as people are getting busier and reopening their businesses. So I think that was part of the response, but I just think people, they don't have the bandwidth right now. They're all concerned with getting their businesses open properly. And with things changing every day and finding out on Monday that you can open indoors on Wednesday, that's a mad dash. And I think the businesses just right now for the next few weeks just need to focus on getting open. And then we'll see what July looks like. We did talk about dropping another survey in July in the event that needs might change and that, visits to town might grow. And a lot of that is weighing on whether or not testing and quarantine goes away, or testing all of a sudden becomes available. So we kind of just put that on the back burner for a couple of weeks in terms of looking for additional public space for members. So we didn't have a need to meet because I think if we saw that there was an opportunity that businesses needed some expansion into public and private space, that we were going to have a business subgroup. But since there doesn't seem to be a need, we did not have one. So.
Okay, thank you, Alice. Again, to reiterate a little bit that came out of the meeting last night, if some business wanted to approach the town and have an idea about something, they can obviously approach the town manager and have that discussion, and the town manager can make a decision. The only issue that is reserved for the select board is if they want to close streets, the select board would make that decision. Our job was to, get a sense of what businesses might want to do, and I think we did that. And right now, I think it's now up to businesses to approach Pat Finnegan and discuss if there's something they want to do specifically. I think that covers us on that issue. All right, Rebecca has her hand up.
I don't know if this is the right time, but I was curious to know about the rules about outside dining and tents and how many sides you have to have open for it to be considered outside. Alice, do you know that?
Yeah, the sides of the tent have to be up. If they're down, it's considered inside dining. Now, that being said, inside dining is now permissible. So as long as you don't have more than 50 people, 50 guests inside the tent, because you can only have a maximum of 50 guests per room. So,
okay, so that's the only limit inside or outside at this point.
And 6 foot distance between tables. Yeah.
So if the tent gets rolled down in the bad weather, that's just fine now.
It's considered indoor dining, and indoor dining is now permissible.
That's great. Thank you.
Yep.
Okay, Terry Ann.
Yeah, just from a public health perspective, that I would just suggest that if you think you're going to outside dining under a tent that has sides down, for those people who will only do outside dining, who are not comfortable yet doing inside dining because of the higher risk, that it is basically inside dining, and in fact may not be as safe because there is really no ventilation when you put down the vinyl side. So I think it's important that the public understand that to be in a tent with the sides down is indoor dining, not outside dining. So.
Thank you. Pam.
To that, I have a question, maybe both either Terry or Alice can answer. Most of the tents I saw had sides that were open. Some had 3 sides closed if it was raining or something, and one side open. Is that still considered outside dining if one of the sides is open?
I honestly don't know the answer to that. I don't know how DECD would respond to that because I haven't had that question come up yet. So I don't know the answer to that.
Thank you, Alice.
I think you would need to check with the code enforcement officer. I don't know if he's on, but he would, for us in this town, need to make that determination. But I think for the public to know, if you've got sides down, 3, not 4, and there's no ventilation, that it is more like inside dining than outside dining. So, but I think the code enforcement officer would need to tell us what is considered inside or outside dining.
Well, as we all know, it's a moot point at this time.
Well, it's
in terms of not public health, but it's a moot point in terms of the fact that they can have the tents and all 4 sides down now, based on the governor's latest order.
but based on what their numbers, what their licenses will allow, they do want to have some of the outside might be considered different from the inside. And I believe it's 3 of the 4 sides have to be lifted for it to be considered outside.
3 of the 4 sides? Thank you.
Well, it's the 3-sided, then it would be 2 of 3.
That was good, Rick. I got it. A triangle tent. Okay. Trying some humor, Rick, right out of the gate. I like that. That's good. All right, Alice, last question for me is, do you expect that the chamber members that are currently using and have outdoor dining will continue throughout the summer to have outdoor dining?
My assumption would be yes, because they've put all the work into setting up those outside dining spaces. And with the 6-foot social distancing requirements inside, the number of people they can serve inside is dramatically reduced. So I think if they've gone through the effort to create a pleasant outdoor space, that they'll probably continue to do so. The only reason they may not is if there are staffing issues. And then they might just decide to continue outdoor dining and have more limited indoor dining if they don't have enough, wait staff.
Okay, great. Any other questions for Alice on that, on the survey or anything regarding business? Okay, well, there is going to be one discussion. We're going to talk a little bit more about queuing, but I think we'll wait until we talk about town density or public health on queuing. I don't have any solutions in my mind, but maybe someone else does. Okay. I know that just by my blood pressure going up and seeing Eric Fogg in a examination room, I have cough anxiety. So I know he's around, and there he is. So Charlie, can you want to take your time and then ask Eric to give us an update?
Thank you, Bob. I'll just give you a quick brief of what Dr. Shah had to say today from the Maine CDC. Total number of cases so far in Maine were 2,836, 2,509 were confirmed. There was one additional death today, bringing us to 102 total. 323 hospitalizations so far, 27 remain in the hospital. That's down 3 patients since yesterday. 10 of those are in the ICU and 5 on ventilators. The important numbers are the positivity rates. Today's rate is in the last 24 hours, because this is actually yesterday's. They did 1,689 tests. 23 came up positive for a 1.36% positivity rate. The weekly positivity rate is 2.49%, and the cumulative overall, they've done 74,549 tests, and 4.39% of those have come up positive, which is a good rate. But as Dr. Shah mentioned, he's headed for 2%. That's really where they want to be. And with that, I'll turn it over to Eric. Thank you, Eric, for being on again this week.
You're very welcome. How's everybody today?
Good, thank you.
Great.
I'm broadcasting live from the Sanford Walk-In today, where it's been a nice day. I'll get you some homegrown numbers, Charlie, to add to your state numbers. So last week I shared with this group that we had no positives in about a week and a half. So a week later, and 726 tests since we started our drive-through on June 1st. We're still over. We have not had a positive outpatient test since the end of May, which is great. We have all of our ventilators available at York Hospital. 0 of 7 are currently in use. We do not have anybody in the hospital with COVID currently, and we have not in almost 3 weeks now, and we have no patients under investigation. So our prevalence rate currently through York Hospital testing anyway is 0%. Charlie, to add to your cumulative, we at York Hospital have done 1,435 tests total, with 58 of those being positive. So we hover cumulatively around 4% as well, but we're running at 0% for the last 2 weeks. So those are all good news. As it relates to your group, we have had 2 discussions with the state in the last 3 days. They have approached us about testing for tourists coming to our state. As you all know, the phase 3 has been pushed up to June 26th, and that brings into account the bypass program with a negative COVID test. So there are two ways that the state has offered to partner with us to support that testing. One is through these swab and send programs that you've all read about and heard about. That is through a grant that the RFP is available now. We're looking at that program, but the state also reached out and has offered to provide us with several of the Abbott rapid tests that we could deploy at an area testing site to be determined. So we are trying to look at the logistics of what that might look like. And this group may be interested in that because it looks like the state would love, well, the term they used was a gateway testing site, but to provide some testing for folks coming into certainly York County and being able to get a rapid test. And the difference, I think that's different than what we talked about last week, is a rapid test is available in 15 minutes. The results is available in 15 minutes. So that might be more attractive to guests, certainly with Alice's chamber group and anyone else in our local communities. So still some things to tease out in that and flesh out as part of that, but those are some of the movements since I last talked to this group. What questions, Charlie, can I answer for you or anyone else on the call?
Yeah, I've got a question, Eric. We spoke yesterday at the club, and I just would like to know, I have a friend who just got back from Florida, and he's quarantining right now. And he asked me specifically, and I think you answered this yesterday, but I'd like the group to hear. He said, can I get that test without a doctor's and without my doctor's permission? And because he said he called his doctor and he said without symptoms, his doctor wouldn't give him the clearance to go and get tested. So can you give us an idea of what his options are, or what other people who are doing the same, coming from Mass or Florida or wherever?
So
what are their options there?
Yeah, it's a great question, Charlie. And it's one that we hear every single day now. And I think the feedback that he got was incredibly common, dating back a couple of weeks ago, that we originally, if you all remember back in March, we were only testing the sick of the sick, and part of that was testing availability and whatnot. With the governor's plan and with an interest in expanding testing through public health initiatives, really trying to understand what's going on with this disease, the threshold has been lowered quite a bit. So as it sits right now, at my drive-through testing site, we do require a provider order. However, if someone did not have one, my walk-in, which is adjacent to the drive-through, could supply that. The patient would just be evaluated through the walk-in. We do that. We've been doing that for 3 weeks now for a variety of reasons. Somebody, maybe a campground, we hear of campgrounds in the area that want people to be tested. Somebody takes care of their elderly parents who wants to be tested. So we've been testing asymptomatic people now for almost a month. So to your question, Charlie, they could be seen at the York walk-in and have be tested right there before they left the property. That's probably the easiest mechanism. So I think you're going to see more and more primary care doctors just ordering these tests in general and not falling under those previous restrictions, because the state can now process more tests, and there's some value in understanding. We're trying to get to a 2% prevalence, right? And so one of the ways to do that is to test more people and really understand. So does that give you the guidance you're looking for?
Yeah. Yes, thank you very much, Aaron.
Pam, you're on mute.
I have a couple questions, Eric. I understand if you don't need a provider order, if you go over to the walk-in, you can get a provider order. If you're coming from Massachusetts, can you do that? Or coming from Connecticut or coming from Florida? Will Maine test you then? And then if you don't get the rapid test, you have to find a place to quarantine for 3 days or whenever the test comes back? And then I have another question after that.
Sure. So as part of the state's phase 3 and what they're trying to stand up in the next week or two is the ability to really just get tested rapidly. There is a standing order that the state has put in place to allow just getting a test without having to go through the walk-in. That just hasn't stood up yet. But if folks are coming to town around the 4th of July holiday, we really see a lot of these. What we've been told by the state is a lot of these swab and send sites will be ready to go, and they're not going to require that you get an order beforehand or have one by your doc back in Connecticut. It's just for folks coming from out of town, specifically, since the governor has put this bypass program in place to support it. I think she's really trying to put a lot of effort behind multiple testing sites. Currently, there's 4 proposed in York County, and one of them is the Ogunquit Wells area. My suspicion is that the CVS and Wells might bid for that swab and send RFP. But to your question, I hope within the next week or two, we'll get to the point where jumping through hoops will be eliminated. Everyone will fall under the state order for standing order to get tested, and those tests will be available at multiple places. To your question about waiting for the result, if it's not the rapid test and it's our traditional, we send it to the state lab or a private lab, my understanding is that you, according to the governor's plan, you have to quarantine until the results are back. So one of the challenges we're trying to figure out, if I go from testing 80 people a day, or 60 people I did today, I think it was, to 400 a day, the logistics of calling these people or trying to communicate that information is something we're trying to process on our end. But the idea would be that you quarantine until the results are available.
Thank you. My second question is about the state of Vermont. Recently, I've seen some articles and on the nightly news and daily news that Vermont, there are parts of Vermont that are quote unquote hot spots again. And if that's the case, have you heard any chatter on the state level that people coming from Vermont would have to quarantine?
I've
right
heard the
now,
same.
I know they can go back and forth.
Yeah, so I've heard the same concern there, but I've heard zero chatter from the state. There were some even areas of New Hampshire I felt when the first announcement was made that I thought fell into a higher prevalence that didn't seem to concern the state or the governor's plans. And so I've not heard anything from the state that they're going to back pedal on that at all or change their mind. I think, a small state like Vermont, when they say it's gone up 50%, we're just talking still small numbers compared to a state like Texas or Florida, where I see that their numbers are getting really, really big. So I still think they're feeling like it's still safe to support those 2 states without any testing. If anything changes, I can certainly let this group know as soon as I hear.
Thank you, Eric.
You're welcome.
Thank you, Eric. Eric, I have a question. Anything about antigen testing and when that might be, just from chatter? I know there's been nothing official, but any thoughts on that?
Yeah, so antigen testing is, you hear it talked about a little bit. You're not seeing widespread use of it. Still, the most sensitive testing is the PCR, nasal swabs. And antigen testing is a little bit of a blood test, usually a finger prick, something like that. I think they struggled with the sensitivity of those and the utility of those. I think this is an evolving situation. The more ways in which we can test, I think the better. But I know of no places in the state of Maine that's doing antigen testing. Our ID doctor talked about this the other day, and she doesn't see anything on the horizon for our area coming that's reliable yet, that's commercially available. So we'll continue to monitor that and see where that goes.
Rebecca.
On that note, the Red Cross has announced that they're going to do antibody testing with blood donors. And I think part of the reason is because they're hurting for blood supplies. And this might be a bit of a draw for people to go in and donate blood.
So the antigen, the antigen and the antibodies are 2 different things. And you're right, the antibodies are becoming popular for blood banks and those type of places, I think, as a screening tool. What an antibody test tells you is whether you've had a previous infection with COVID, where an antigen test is another way of measuring an active infection.
And so can you donate blood at York Hospital?
So you can't donate blood at York Hospital. We rely on the Red Cross as well.
So where would you go locally if you wanted to donate blood and get an antibody test?
Yeah, so I know where you can go and get an antibody test, and I'll tease that out. I know that so if any of your physicians order an antibody test, we'll draw it at York Hospital. It's a send out for us. It gets sent to a commercial lab to be processed. I think Quest has been the biggest lab that's done antibody testing. So we've seen them ordered. Our infectious disease docs are not recommending that for our network of physicians because the problem with the antibody test as it currently states is, although it may indicate a previous infection, what we don't know, because it is a qualitative test, is we don't know that those antibodies signify active immunity or how long that immunity might last. So it doesn't give us any information to give somebody a recommendation about re-entering or seeing sick loved ones or that sort of thing. So what it's been good for is from public health measuring about the prevalence of the disease. Also for folks who want to donate plasma, if they've had a previous infection and believing that donating your plasma to folks with an active COVID infection may be helpful. In terms of donating blood, I think we rely on the Red Cross and some of their mobile units, which if anyone else knows, I haven't seen them really in York County recently. Has there been any blood drives going on locally?
There has. I know St. Mary's Church in Wells had a blood drive from the Red Cross, I believe 2 weeks ago.
Okay.
So I don't know what kind of pre-testing they're doing prior to drawing blood. I know they're not doing plasma, but they're doing it in blood.
Got it.
Rebecca?
I know a few people who suspected they had COVID, but weren't very sick and never had a test. So they're really interested in an antibody test.
Yeah.
Find out if that was in fact what they had.
Sure.
I'm curious about, well, first of all, is the rapid test going to be more expensive?
So what the state is, so they're talking about donating 2 to 3 of these Abbott tests, and they have a cartridge that goes in them, and that's the rate limiting factor about how many tests that we can perform per day or per hour. And the pricing of that is actually cheaper, I believe, and we're talking somewhere around $50 is what I understand as part of the discussion that we had with the state the other day, where our send out tests were over $200. So I think it's significantly cheaper, but I'll anticipate somebody's question in the audience. There was a lot of literature in the newspaper a couple weeks ago about how sensitive these Abbott tests were, that there were some early predictions that they were about 60 to 70% sensitive, which actually makes that certainly a concerning test. If you're going to hang your hat on a test that's only 60 or 70% reliable, how good is that? However, at York Hospital, all of our admitted patients, particularly ICU patients, get a Abbott rapid test. And what we've done is, if the test is negative, yet their symptoms are suspicious, we always send a second test out to confirm as a backup. And we've not had any discrepancies between an Abbott test and a send out test yet. So it seems like from our smaller sample size that the reliability and the sensitivity seems to be much higher than some of those reported statistics that you might have read about.
One more question. It's going to get complicated, especially for you, if you're reporting back to other states a positive test.
Tell me about it.
That is the way you're supposed to do it, right? So
we report it to the main CDC, and then they do the contact tracing. And you're right, it goes back to the originating state where that patient comes from. But yes, it's going to get complicated for a lot of people.
But then that person isn't counted as a positive test in Maine, is that right?
That's correct.
So for example, the 13 workers at Eldridge who tested positive, they may not have been, were they counted as part of your county?
So I don't know the details on all of them, but it's plausible that some of them may have lived in New Hampshire, for example, given our proximity. And if that's the case, that we might not have got credit, so to speak, for all 13 of those cases if they're lived in New Hampshire.
Right. Okay, thank you.
You bet.
Any other questions for Eric? Okay, if not, Eric, Johnny Carson used to say, if you're invited over to the couch, you have a great future in this business. So you've been invited over to the couch, you have a great future in this business. Appreciate you coming here, and I'm sure we're going to ask you back. It's been most helpful for us, and I think it's great for the residents and visitors of our town as well as the county. Appreciate it.
Well,
Thank
thank you
you.
guys, and
Oh,
let me
Rick
know how I
wants
can
to
help.
say something.
Okay,
Rick?
Can I ask you one last question, Eric? I'm sorry.
you bet, you bet.
You wanted to get out of here. If somebody does test positive on site, like even with rapid or not, are they allowed to? What do they do? I mean,
Yeah. We had that same question with the governor's cabinet the other day. We certainly don't want to get in the policing business, and that would put us in an awkward position. You have your family of 4 up here as you're heading into the state, and someone tests positive. So what we were advised by the state is we do the reporting. This is a positive COVID test is a mandated reported test to the Maine CDC, and then the Maine CDC handles it. So we're not directing people to go home and that sort of thing. We report it like we normally do, and then go from there. But it's a great question, because they could leave my site knowing they have a positive test and come in and check into one of your hotels, right? So
sign off saying that they have a negative.
And they're going to be asked to sign that declaration, right? And how truthful they're going to be. It's a challenge, no doubt. Good question. What we were advised was we report it like we normally do, and it goes from there.
Thank you. Appreciate it.
You bet. You bet.
Now you can
Okay.
go.
All right. Thank you, Eric. Appreciate it.
Thanks, guys. Have a good meeting. We'll talk to you.
Okay. So we're going to we'll move on then to update from the field. And maybe we can combine update from the field with the data group, because it's all kind of in the same vein. So Matt, you unmute yourself and tell us what's happening.
So I think the story this week is similar to the story last week. I think our challenge, both observed and reported back from other people, is the marginal way. It's obviously an issue of concern for a lot of people due to the narrow nature of the path and the popularity of the path. It was brought up at the select board meeting last night as well. We currently, we're now transitioning from where if you can't social distance to where you must wear a mask. So while in the interim of between what our signs currently say and the new rule as of last night or today that you have to wear a mask on the marginal way, we are still having a CSO or CSOs out on the marginal way, and we are still providing masks as needed to people on the path. But in all fairness, we can tell people they have to have a mask on, and we can direct them to leave the marginal way, but there's not a lot of other enforcement actions we can take because there's no notice essentially yet. We're working on new signage or updating existing signage to make it crystal clear that masks are required on the marginal way, but there will be a window of ambiguity with signage versus rules. So we need to do that. Say that we've been generally very impressed with the beach and the distancing we've observed on the beach. The beach has gotten somewhat busy on nice days. Today was a really, really nice day, and the tides are with us right now. So the high tide is early in the morning, and it's going out all day, and that's perfect for us right now. That obviously won't always be the case, but we've noticed family groups or groups that come together are sort of staking out a plot in the sand, and other groups are distancing themselves what we would consider appropriately, at least 12 feet or more. I would say that there's still a bit of a bottleneck by the main beach entrance, which there always is. And Buzzy, I can see you nodding. Yeah, I mean, it just is what it is, right? by the nature of the fact that there's only a few ways on and off, and people are creatures of habit. But I will say that we've noticed it appears to be people spreading down the beach better than a normal year. Also, it's very early, and we really think the next 3 to 4 days are going to be a really significant test for us as far as what a beach day looks like with these restrictions and with the parking lots open, restaurants, in-person dining allowed on a limited basis, those kind of things. So in our eyes, things are starting to look more like normal, if you will, quote unquote, since I don't like camera, I'm doing air quotes. But I think that we're really going to use the next several days to gather information on habits and densities, like we talked about, because kids are done with remote learning. So it's like summer now, and it's going to be warm. So we're sort of using that in our favor, if you will, to do some observations. We have noticed that town is pretty busy during the day. So the restaurants, businesses, a lot of them are open. It's sort of a bustling place. But we also have noticed that in the evening time, say once it gets dark, town dies out. And that isn't what we're used to. So Ogunquit normally has what I would call a very bustling nightlife. So, it's very different right now in the late evening or evening. We don't have that nighttime rush or that nighttime crowd that we usually have this time of year, and for a good bit of time leading up to this. So there was some question I had as to, and I don't know, I was texting with Rick about it earlier, is the governor had mentioned something, or the press conference mentioned something about reevaluating the bars opening. Did anybody else see that? So it's more of a question than an answer, maybe Terry Ann, but I saw that. It
just came on the feed that they're delaying opening bars.
Okay. And did it say a date or anything?
No, data, they're following the data, not dates.
Okay.
And they're looking at four places in the country that have had experiences and have not had fallout, so they're delaying it. They have not yet decided about what they're going to do with restaurants that have bars inside them. So anyway, that was what I saw today.
Charlie, you have your hand raised. Charlie, you're on mute.
I'd like to add that during the press conference today, and I think Terry Ann alluded to it as well, Dr. Shah says he's been kind of following a couple of four different areas. And the first one that he mentioned was in Springfield, Missouri, where two particular hairdressers were tested as positive and had about 140 customers in the time they were positive, and not a single one of them came down with COVID-19, and they suspect it's because they both had face coverings on. The stylist as well as the customer had, and as you know, a hairstylist is inches away from you. So it was quite significant, as opposed to the Lake of the Ozarks, which is another one they're keeping an eye on, and the bars in Jacksonville, Florida, which is the opposite, where there were people who didn't have face coverings, and it was just the opposite of the two hairstylists. So face coverings do make all the difference in the world from what they found out so far.
And Boise, Idaho was the other one where there were bar issues. So.
I don't have questions about bars. I have a question to Matt. When the lifeguards finally do start working on a full-time basis, I know they're doing a lot of their training and everything right now because you see them down on the beach. They typically put cones to make a large runway so if they need to get in and out of the beach quickly. Do you think that will help at all in terms of people? Right now, I notice people are still, basically, they come off the walkway down into the beach and they dump right there. When they start having to spread a little bit, do you think that you'll see, I know every year you get people right there that sort of cluster all along, but I don't know.
Yeah,
if
so I think those cones obviously help that entryway directly, and the point is so they can that's there so they can launch the jet ski and move the jet ski, and so that's always kept clear. And the lifeguards have been working for us, particularly on the weekend, or with us, sorry, particularly on the weekends, helping remind people of social distance and things like that on the beach. They've been great. And I imagine that our conversations with lifeguards as they roll out on a say full-time basis for the summer will be helping us maybe encourage a little bit more spread out there, because those areas adjacent to the ramp are the most popular areas probably on the beach. Because if you sort of know the tides in Ogunquit and you want access on and off the beach, that's kind of the spot where you can keep your sand all day and you have access to, say, you know, the restrooms and the shops and things like that. So that's sort of prime real estate. I have noticed people spreading out, I think a little bit more. I personally would like to contribute that to all of our wonderful signs. But I think people also people like to be out and about. And I think there is an awareness now about distancing. And I think people are doing some of that, but we're still people and we're still creatures of habit. So it's easy for us to fall back into our old sort of routines. But again, from our perspective, the police department's perspective, things are looking more like summer as far as daytime, but the nighttime to us, late nights looks like a different world here. And Buzzy being in the square normally where his business is, it looks so different at night quite frankly, without bars open. The town of Ogunquit at night looks incredibly different.
I've been downtown Ogunquit for 20 years now, either at Joe Allen and it's an absolute different animal, like nothing you've ever seen before. And even when the bar's open, you know, we'll see how it goes. And it seems to have your regular staff on at nighttime when it's a ghost town. You know, it's a whole new paradigm, and we'll get back to a more of a boisterous crowd at some point in the near future. But yeah, I can imagine what it transitions for you guys. It's not Fun Town, Splash Town anymore.
Yeah, I mean, I would describe it, Buzzy, kind of as like wintertime, January, February, nighttime, in the summer. So for us, we're sort of not adapting because we're sort of trying to figure out what the dynamics look like going forward this summer, and because we tend to staff towards calls, right? Because we staff our officers based on need and call for service, and the more people you have and the more calls for service you have, and that right now is shifting to us towards the daytime as opposed to the nighttime. But with openings coming and going and timetables unknown, it's still a little bit of a ambiguity for us. But that's the biggest thing for us is nighttime here.
Yeah, I had two more questions, Matt. You said you were going to be redoing the signs on the marginal way. So the signs currently now say, if you cannot social distance, you have to wear a mask. Is that so? Those signs will be coming down?
They will likely have to come down because now it's masks required on the marginal way, period.
Okay, and I guess I somewhere must have missed that in last night's meeting that they voted on that. I'm assuming the select board did, because I don't remember them taking a vote to say that.
Maybe Bob can help, but they did, right?
Yeah, I'll do a report, Pam. When I get to public health, I'll fill you in. So
okay, and then my other question was about the bathrooms. As I've said many times, I don't use the public bathrooms. But what I did notice that as I walked by and they were open, there were no marks delineating staying 6 feet apart. There were no signs saying 6 feet apart. There was nothing in there that, nothing that I could visually see that the numbers
Yeah.
of people, every store in town, if you have square footage, you only can have X number of people in that store
Right.
or in that restaurant. So I don't know if this is still something that's part of going forward. And with that, also the hand, the fact that there are air dryers for the hands that are still in there, as opposed to, use of paper towels or anything. And I don't know if there's any, if that's falling under your direction or falling under Public Works or what.
So it's not, definitely not under my direction, but I can tell you that they are. Darren was talking about Darren Dixon, who runs facilities, was
Yep.
talking about having to order more paper towels, so as to do away with the blowing dispensers. That's the last conversation I heard on signage at the bathrooms. That is under something that that I was working on, and I'll be honest with you, it's so I definitely dropped the ball on it, because we've been so busy putting signs everywhere that as things started to open, the bathrooms, at least originally for me, were overlooked. We have signs, on order for the bathrooms that talk about social distancing and 6 foot spacings and masks, and still limiting obviously how many people are in there. We do have attendance at the main beach bathrooms, but all of the other bathrooms are essentially self-policing. So a store can say you can't have more than, say, 5 people in it because they have someone who works there. But we don't have someone at every bathroom saying there's already 2 people in there, you can't go in. So a lot of that is going to be self-policing. We are getting A-frame signs to put out in front of every bathroom that will have the rules, and that will have, again, some of the recommendations, the CDC best practices on those. And those are coming for every restroom, including the main beach, for when there may not be an attendant on duty, but the bathrooms are open.
So there is a limit to the number of people that can go into the bathhouse now. Is that correct?
I honestly, I don't know. I assume, I don't know that the bathrooms, I haven't seen anything that specifically says public restrooms fall under any kind of limit. I assume it makes sense that there's a limit, but I don't know what that is. There's not in the state. There's probably not a ton of standalone restrooms. Most of them are contained within an establishment. Now, there are rest stops that might have bathrooms and things, so there might be a rule on it, but for me to tell you definitively, I don't know. I'll have to find out.
Thank you.
Okay, just for clarification, the select board did vote to require masks on the marginal way. The vote was 4-1, as I recall.
And I did
All
just,
right,
not to
Matt.
interrupt, I got a message from the town manager that the town is applying to the Governor's Keep Maine Healthy program to get more attendants to help us with social distancing at the bathrooms. So that program, or that monies that's been made available for prevention and education programs, the town is applying for monies for that to hire additional attendants for other bathrooms.
Yeah, that's going to take a while for that money to come and get filtered down. So, but
Well,
thank you.
the applications are due by the end of this week or Monday. And I believe that it would be likely that the town would make some sort of decisions on staffing prior to those. So you might see staffing before you see the reimbursement.
Okay, last question is from Rebecca, because we have to move on. Rebecca, you're on mute.
Is North Beach open fully now?
Yes.
Thanks.
And I
Okay.
did notice Footbridge and North Beach, when I've walked by the last couple of days, very few people there. So I don't know whether there's a way, Matt, that whether it's the visitor services can encourage people when they come in to check out other parking lots and other beaches, because there's like
Two
hardly.
things, sorry.
So, no,
Two
that's,
things I think are typically those lots will fill up after the main beach lots fills. And then another factor that is plays in is a lot of that parking, we believe, is taken up by some of those seasonal cottages on the line in Wells that are seasonally occupied 6 months of the year, and those are significantly restricted as far as who can be there now. So I think that's a limiting factor as well. But we can certainly talk to visitor services about encouraging the spreading out of your cars as well as the spreading out of your not only because it's good practice, but it's likely less expensive for the customer if they check out a satellite beach.
And if they had food, people would park there. And they have
I
no
know
food.
I would.
I would too. There's no food. And if you come with kids, you need food if you don't have everything with you.
I think, Pam, there was some discussion, this may be unrelated, about food trucks at some point. We
It
had heard
was,
that,
I
but
don't think they
obvious-
ever made, the select board never made a decision about that. There wasn't.
Yeah, and COVID happened, and I think that dampened the discussion, period.
Yeah.
But I think it's something on people's radar at least.
Okay. Thank you, Matt. Appreciate it as always, and thanks for your service to the town. Moving on then to data, and Kent and Rebecca. Kent.
Yeah, so Bob, no real new COVID data this week that Charlie and Eric hadn't already talked about. There were no updates on the by zip code reporting this week since we reported out last week. I'll be looking at some traffic flow reports from Matt later this week. We're still trying to figure out what the current congestion may be and what we could predict for this season. Traffic is one data point that we'll look at. Alice, I'm wondering if we can get any 2019 summer data from any of the businesses on the part of this we're trying to figure out is what the day tripper inflow, how that influences congestion. It might be helpful if we can get some 2019 data from the hotels and restaurants, maybe on volume on a weekly basis or during the week and then on the weekends, just to see if there are trends from one week to the next, and then overlay a COVID factor kind of number on top of that. But I think really to tackle this question, I think it's going to boil down to observation and what we're seeing around town in the common gathering points to really know what the problem is we're facing. It's just really hard to pin a number on it, I think, at this point.
So it would be hotel occupancy from what time frame to what time frame, and same thing with restaurant busyness, I guess.
Yeah, I think if we were able to look at trends on hotel occupancy, say for the month of June, and does that increase as we get closer to the end of June? And then the same for restaurants. How many dinners or plates did they serve per day? And just look at the flow of that data and really look at where the concentration is of the big volume. So it may be weekends where we see the spikes. I'm guessing it would be weekends where we saw the spikes. And then if we can
just want June, or sorry, go ahead.
Go ahead.
I said, did you just want June, or do you want us to do June, July, August, September, October to get kind of a seasonal flavor?
To get the seasonal flavor as much as we can get on a weekly basis through the whole season, just to see what that looked like last year, what the trends were. And like I said, if we can assume some of the similar trends, would put a COVID factor on it with all the other drivers on restrictions on who can come to the state and those sorts of things.
Yeah.
And then overlay some of the parking lot data that we're getting from visitor services and the traffic flow reports that we're getting from Matt, just to see if we can get to something that's a bit predictive on what the summer could look like for us.
Okay.
Ken, I'm assuming you have all the data from visitor service about last year's parking. They had that all week by week by week, the whole summer since the time they started taking.
Yep, I've got it all laid out. I'm just waiting for new data to lay on top of it and see what that looks like to do some sort of a comparison.
Thank you.
Yep. That's all I had, Becky. I know you had a couple of points you wanted to talk about.
I just wanted to mention one, and that was some hospital financial data that came out this week from the Maine Hospital Association. And of course, they're estimating a much greater loss in revenue from canceled procedures and preventive care than the reimbursements that have been promised and or delivered so far from the federal government. They're reporting that their volumes in hospitals are back up to about 75%. They'd like it to be back to 100%, so people shouldn't delay in seeking out care or procedures that they needed that might have gotten canceled. They should rebook them. There's 36 hospitals in Maine, 9 of which are part of the Maine Health Network, which includes York and Biddeford hospitals. And those 9 hospitals have gotten the chunk of money so far from the federal government, but they've only received about 70% of what was promised. So the message was that the hospitals are hurting and people should go back and get care, not that they should necessarily get sick or disease, but that there's no reason to delay having a procedure right now. And in fact, I have a friend who needed major surgery and waited in Massachusetts and finally got rebooked at Maine Med and successfully had her surgery. So people shouldn't be waiting for what they need. That's it.
The one thing with that, Becky, it's to the best of my knowledge, only because I know a couple people right now are having some joint replacements, you still cannot have anybody from your family with you. They still leave you off on the door and pick you up when it's over. And for many people, that becomes a deterrent to want to come back into the hospital to have any kind of major surgery and be by themselves. So it's a catch-22. But
I can really understand why they would feel that way, for sure.
Yeah, and especially if you're having a larger procedure done. So.
Okay, thank you. Public health, Terry Ann and team.
My team of one, Buzzy.
I
So
should write Terry Ann and Buzzy. I apologize, Buzzy.
my
You're a
team,
player, man. Come on.
he's my teammate. So I'm just going to focus on Marginal Way today because the last evening the select board did vote to require face coverings on Marginal Way as long as it doesn't violate the Americans with Disabilities Act, given that you really can't social distance on Marginal Way unless you go very early in the morning or on a cloudy, rainy day, then you can maybe spread apart, but you can't social distance if you're passing at all. So I'm really pleased about that because even though being outside is always better, we still need to achieve about, at a minimum 70% use of face coverings, and we're getting more and more data every week about the positive effect on preventing the spread of the virus by the use of face coverings. The most recent monitoring over this past week by Joan Griswold's volunteers was that the weekly average has stayed below 50%, and that the range during the week of those not wearing face coverings was anywhere from 33% to 61%. There were no reports at all of any confrontations between the volunteers who were observing and people on the Marginal Way. And I don't know whether Matt had any reports of people getting upset when they were offered masks, but the observers didn't have any confrontations. There are, people are repeatedly concerned about requiring certain behaviors because how do you enforce them? And I would just remind us of the value of observation. One is that we know where we stand so that we can ask ourselves, are there more things we can do? And I think that's what the select board did last night. And it also gives information to people like me. I do not want to go walk on Marginal Way until we get up to about 70 to 80%. I will not expose myself. I will always wear a mask, but I will not expose myself to those who choose not to wear it. So that information is important to us who may want to walk Marginal Way, knowing where it stands. The other thing is, I have said many times, individual enforcement actions are not the answer. And by individual enforcement actions means I do not expect the police to hand out citations or to stand on either end of the walkway and prohibit anyone without a mask from walking. People do have some level of choice. If they choose to expose others by not wearing a mask, then so be it. So we have to continue to educate and to provide incentives. So the CSOs offering masks to people is a great idea. If people don't want to take them, fine. Putting a sign up, we have a bunch of signs around town right now that say, wear face coverings. It doesn't say required, but it doesn't tell you wear face coverings if you can't social distance. The signs say wear face coverings. So we're doing that already. The other thing I wanted to say is I did speak to the Maine Human Rights Commission today about the ADA. I actually was the first director of the Maine Human Rights Commission when it was founded back in the mid-70s. So I'm pretty familiar with anti-discrimination law and was involved in passage of the ADA and also amended the Maine Human Rights Act to prohibit discrimination against people with disabilities, and confirmed that because there would be no harm to an individual who, with respect to discrimination, that they would, although it's a public accommodation and people could file a complaint, unless they were cited, unless they were prohibited, unless they were told to get off, that they would not have standing under the Maine Human Rights Act or the ADA. So I think we're good to go, and I really appreciate Joan's group continuing to monitor that so we can know how we're doing and make sure that we can make informed decisions about whether we want to walk, and so that we can continue to look at what we're doing to encourage people to use face coverings. So that's it. Buzzy, did you want to add anything?
Yeah, can you hear me? I just want to add on to what you're saying. I didn't realize that the select board did vote to mandate masks in the Marginal Way. I think that's kind of a good thing. I think we should, like, again, try to use a little social engineering, like, no mask, it's your task to step back, or, no cover, don't hover. Like, if you're walking down the Marginal Way and you have a mask and you're coming at me, you don't have a mask, you're in the shrubs. You need to step aside. Two people coming down the Marginal Way without masks, both go 6 feet to each other. We got 12 feet space, it all works. So the mandate should be for you, if you're not wearing a mask, or you're one of God's special people who can't wear masks, or, you can't, then it's your responsibility to get out of the way of the mask wearer. And then the onus is not put on like it's a 50-50 Mexican standoff. And there will be people who don't want to wear masks for various invalid reasons. I'm not doubting there are valid reasons for people can't wear a mask, but just like every 80-year-old woman with a service dog and they're like on their lap at every restaurant right now, we can abuse these things a little bit. And that's it for the I'm grateful for the people at the Marginal Way helping us with that, the information, and common sense, and just, we're going to learn and grow together. And that's what we've all been saying, I think, a little bit since the beginning. Thank you.
Okay, thank you, Charlie and Pam At risk.
I actually don't have anything. Nothing new to add at all. My only thing I have to do is the website. I will change the website because it says for Marginal Way right now. It does say social distance. And if you can't social distance, you do have to have a face covering. So I will change that up there. And, but other than that, I don't have anything.
I just have a brief, a short amount of information, and it's really not anything new. I mean, as far as people at risk, I really think that the situation there in Springfield, Missouri, really brings it to bear that masks make all the difference. And this was with two hairstylists who, as you know, are really close to. And of the 140 or so clients they had, not a single one tested positive, and both of the stylists were positive. So the stylists wore a mask and the clients wore a mask. So it proves that is effective. So as an at-risk person, boy, it would behoove you to wear one and not to go anywhere where people are not social distancing and not wearing masks. So that can make a really big amount of difference. So I would really reiterate that. The other thing I might mention is at this time, and I'm a little excited about, is we got 3 new bike racks for the town. The town managers just got in touch with me this morning, and those will be put out, I'm hoping, by the weekend. So just so you know, an awful lot of people are buying bikes now. You can't get one, as a matter of fact. So we're going to have 3 new bike racks. So I would encourage anyone to ride their bike to the beach, if they were going to go to the beach, and to bring their mask and to use the new bike racks. Thank you.
Thank you, Charlie. Pam, I put on here music in the park. I don't know if there's any update, or one question I have is, I think June 26th is the first Music in the Park event.
That is
And
correct.
they have, yeah, and I don't think there's anything that we need to do, right? Or do
No.
we?
There's nothing that we need to do. They are very cognizant of the fact of the numbers of people that they can have in the park there, and that they need to social distance. And if there's groups together, if there's a family unit, they have to be 12 feet apart, similar to the beach. They're aware of that. They were working on signage for that. I know they were going to approach Matt, and I don't know if they have Matt, to have a CSO officer there during the concerts.
Yep, we're all good with that.
Good. So that was one of those items that had not been checked off their list, but they're ready to go. Like I said, I had the opportunity to speak with both Brad and Dan Green the other day from the Playhouse, and they were talking that maybe they could help them for some of their bigger, like the swing band or something like that, if they had larger crowds. Again, nothing has been done. Jason, I don't believe, or Michelle have contacted them, but they would have to follow all the same protocols and all the regulations. So, and they seem to be right on top of everything. I've had a couple conversations with them now.
They do, and they have not reached out to the Playhouse. Brian Crawford is also working closely with them.
Yeah.
And
I think that Jason was coming back from California. They were driving. So, maybe, they put off the larger band until towards the end of the summer. I think their biggest group is the Elvis show.
Yeah.
And that's in mid-July, I believe.
Yeah, and I think the swing band concert actually was canceled.
Yeah.
Yeah. So yeah.
I think they're on top of everything, and they're trying to make it as accommodating to people coming, but still obviously, like the restaurants and the hotels and everything else, following all the right protocols.
Thank you. Okay, Matt, we can open up to any hand raisers. We haven't seen the chats because I think we're on the select board version of the Zoom. So maybe, or maybe there are no chat.
Nope,
We
you
don't
are
see
on the
any.
select. You are on the select board version of chats. I can open up chat.
So we didn't get to see chats which I like, because that way everyone can concentrate. So now we can see all the chats.
So chat's
Which are-
open, and if anyone wants to raise their hand, I will let you know if they do.
Okay, great. Thank you.
Hey, Bob.
Hey, Rick has his hand raised.
Hey, I raised my hand. I was standing out in front of my inn, as often I do, and somebody stopped to chat with me a little bit, and asked if I would mention this, and so I told her I would bring it to the group. She was concerned that the candidates running for office are standing out in front of the post office, which is tradition and what they always do. You're concerned that that might start getting crowded and people won't be able to walk by. I mean, not to belittle what she's thinking, but I can see what she's saying, that if there's 3 or 4 candidates, because how many do we have running this term? But she was just wanted me to bring it to this group. And so I said, okay, I will bring it. I'm not saying one way or the other, but I just thought it was an interesting, sort of similar to the march in a way, or the footbridge. The sidewalk right there is narrow. So I just said, okay, I'll bring it. So I did.
Rick, I was there today. There was one candidate, and that candidate had somebody with them. They both had masks on. They were not 6 feet apart, but anybody that they approached had masks on. So I did not see anybody walking up to the candidate, nor the candidate's worker bee, so to speak, not have masks. But they were not on they were on the sidewalk. They were not on the grass or anything. So it may get congested on the sidewalk on a Saturday. I could see that.
Thank you,
We
Rick.
do have a raised hand now. It's Jim Hartwell. If you guys would like to hear from Jim.
Okay, thank you.
Jim, if you unmute, you should be all set.
There we go. Can you hear me okay now? Okay.
Yes.
I'd just like to make some comments real quick. Start with where Charlie started back at the beginning of the meeting and kind of fly through some of the things, something that Eric said, Kent said, and whatever. Excuse me, but sometimes I recall a song from the 80s. I don't know if it was Huey Lewis in the News that said, "Here we go around in circles." And I sort of feel that way sometimes because we touch upon all the issues, but I don't see the dots being connected. And that's probably the biggest problem for me, maybe not for anybody else. Starting off with Charlie, his comment about his friend who talked about having a doctor's note or whatever, permission slip to get tested. That's all we're hearing at the end. We're hearing that from everybody. And we may find it's hard to believe, but most people are honest. And they don't want to sign any paper if they haven't been tested. And that's when you stop and think about that. We sort of been by the state put on the front line as the lodging industry, because we seem to be in a position where we're supposed to be the gateway for all the visitors that come to Ogunquit or to any of the towns in southern Maine. And right now, it's pretty evident that with where we are in the policy, the state policy, nothing's going to work. Now I'm starting to hear complaints from some of the restaurateurs because, listen, Ogunquit's not that big and you can't fill every restaurant with just the residents, and a lot of the residents aren't going to go. So where's the business going to come from? Well, the lodging, as far as the lodging facilities are concerned, they're shut down. I mean, we're operating, we're open, but we just can't do any business right now in the current conditions. So maybe a lot of people feel good that the restaurants are open now on the outside and for inside, and that's probably okay for Portsmouth or some of the larger cities. But what are the small towns supposed to do that depend upon all of the people, vacationers that come to Maine? They come here to stay, they come here to go to the beach, they come here to dine out. And that's primarily the 3 big things that they come here for. Now, as far as Kent was talking about gathering data for the summer, the only comment I can make, Kent, is if things don't change fairly soon, you're not going to have to worry about historical data for the summer. And when I hear Matt talk, I don't know how many people are tuned in today listening to your meeting, which I think is excellent. I want to commend you guys for all the hard work you're doing. But when you hear Matt talk about out in front of Buzzy's place, looking like a ghost town, and at night everything's shutting down and everybody leaving, that's going to be typical unless something changes. And I guess the last thing I want to make a comment on, so you can walk into a restaurant now, you can have your choice of inside and outside dining. That's great. I got a 400 square foot room, and I've got a 750 square foot suite, and I've got a 1,200 square foot suite. Now, could you think of any better way to satisfy the social distancing by putting a husband and wife into a room of that size? Think about it. 6 feet to 12 feet social distancing on the beach or in the restaurant. But I can't put somebody in the smallest room, which may be around 400 square feet with own private bath and air conditioning. That person, those people don't even have to go out of their accommodation. I'm sure Rick realizes the same thing in his facility. You don't have to go out of your room. If you go out of your room and you want to wear some little cheap plastic gloves, we'll give you while you're in the inn. If you want to sit down in a chair and pick up a magazine or whatever you want to do. But I'm just trying to work my way around the hypocrisy right now, because I consider my accommodation to be the safest place in Ogunquit. And I probably would say, I think the people at the Norseman would say the same thing, and the Anchorage and whatever, because people are alone and they're segregated from the rest of the community. So I don't mean to put a damper on it, but in all of these discussions right now, and I really like the thing that Charlie brought up and Terry added on the hairstylists, that's a lot of people for those people who have, done, provided hair styling and so forth, for people to walk away and not be affected. And I guess it really shows you how good the mask can work. And maybe that is the solution, and not all this paperwork and all these rules and everything else that people just cannot live with. It's serving as an impediment as we go forward. I don't know how we solve that, but until that changes, we're going to have a dead town. A dead town. So anyway, I'd like to thank again everybody and giving me the time to say that. But I think, sometimes you just have to put the cards on the table and recognize what you're dealing with. And the clock is ticking. We're heading to the end of June, and we can't take we're not getting the reservations. So thank you again, and have a good evening.
Thank you, Jim. Appreciate those comments. Matt,
There are no other hands, Bob.
Okay, and I don't see any chats, so I don't know if the chat's working.
The chat's open.
Chat's open, okay. Well, then we can move on. I don't believe we have any motions for recommendations at this time. I'll make a small comment. I haven't made many comments tonight. I'm starting to see in some chat rooms and Facebook chats, these are anecdotal, a certain negativity about Ogunquit and Maine from outside. I think we're doing a great job of managing health here. I think our task force is doing a fantastic job. What worries me a little bit is this small but growing antagonism towards our town could grow, and that would be hard to reverse. When a business suffers some calamity like Chipotle or others, it takes 18 months usually for the public to forgive or forget and move on, and they then rebound. I'd hate for us to be in a position where, of course, again, all the good things we're doing from a health perspective are necessary, And I'm not making any critical comment towards that, but I think we have to keep in the back of the minds. I think this is what Mr. Hartwell is also talking about. I don't know Mr. Hartwell at all. I never met him, but we have to be, I think, a little bit start thinking about how are we going to become, and at what point are we going to become a welcoming group? And that's just something that I've been thinking about. Again, I think we're doing exactly what we need to be doing. I think everything has gone in the right direction. You know, I think the task force has done a remarkable job. You guys have really contributed to the safety and well-being of the town, our town. And I think we've made appropriate decisions for the most part. And I just, at some point down the road, I think we may have to pivot. Buzzy, you have your hand up.
I just want to, every week we usually get a comment from someone like Mr. Hartwell or somebody else. And, we're a state that has, under 2 million people, and we're a tourism state. Well, this pandemic has dropped right on us and people can't come in. So I appreciate how much these businesses have done everything to make themselves as safe as humanly possible. We cannot change public opinion. We can't all of a sudden say, listen, it's okay, and it's okay to go here. That's impossible for us. And the effect on the economy, he is not wrong on. I mean, it is going to be epic. You do 10 million tourists and only do 2 million this year, it's going to feel all around. As for Ogunquit, on any type of negative energy Ogunquit's faced a lot of negative energy for other reasons, and it's always risen up. It's always been a beacon of decency, and we rise above stupidity and ignorance and intolerance, and we move forward. And that's what we do here in Ogunquit, and that's how we're going to do it together. And these businesses, I wish them all, we want them all to succeed. There's nothing more please come, and we can't spend our own money. All us locals can't spend all our money to keep these businesses afloat. It doesn't mathematically work. This is not changing. The Canada's not coming. Canada's not coming. The Playhouse isn't coming. I don't care if you can take a bath and sanitize it when you get to my hotel or my restaurant. That's going to trigger people not to come. It's going to take a while. It's going to be a huge culling. And I feel for everybody. I think we're all, because Maine is all small business owners a lot. So we're all got our hands in this pot, and we're all getting burned by the current situation. I just think that if we try to, if we don't understand that, and I think that's some expectation that we should do better, or we're not doing enough as a town, I think is misguided, and it's not going to work, because it's not true, because we are trying. Here we are all given a care about how you walk on the marginal way. You know what I mean? And I think the business owners have been amazing. They have answered every bell. They've tried everything within the reason. They haven't gone half-cocked. They've been truly inspirational, And again, people think they come to this town for the businesses. You're wrong. They come for the ocean and the water and the mountains. Those are nice amenities we have here. Okay, we could take all these restaurants and move them into Alfred. Their business is not going to be surviving the same way. We are here on the coast because this is the Riviera. That's where we're at. So we need to appreciate that. We need to hold hands, grab an oar, appreciate that business is going to need a lot of help. And there's only so much we can do as a community. There's only so much we can do as a community. And empathize and sympathize and work with us. That's what this task force is about. And I think that's where I feel like some of these people have complaints. They're valid, your business, but we're looking holistically. The state of Maine is shut down, and when we open or how we open, it'll be tiny, nothing like you expect, nothing like the margins. I hate to be the bad news guy or whatever. We all know this. Everyone knows this. I mean, everyone wakes up with a new, it's a different world. The things when I ran my restaurant last year, it was a different animal last year. Even Matt could say, never mind how quiet it is at night. We allow drinks to be taken out of restaurants now. That has had zero effect on anything. If we allow drinks going out in restaurants the last couple of years, it looked like Mardi Gras down here. And that's okay. I mean, we're learning to curb with that. That's just an example of how we're growing to help businesses to mitigate the COVID thing. Not Governor Mills, not the state of Maine, not the tourism industry or the bad people from Massachusetts or anything. It is what it is. So solidarity and unity is what we need, and that's what Ogunquit has stood for. And that's all. And I wish the best to everybody. I yield my time.
Alice.
We have a ton of conversation about this at the chamber, as Rick and Kent could attest to. And I think the negative PR is really coming out of the quarantine and testing because no one can come here. So I don't think, Buzzy, that it's unique to Ogunquit. I think it's the state of Maine. People have this negativity about the state of Maine because they don't understand why it's so hard to come here, and they really, really want to come here. And we've talked a lot about, we're developing signage for the southbound and northbound entrances into town that are super, super welcoming. We missed you. We're so glad you're back. I mean, we're going to try and do as much positive messaging as we can to make the people who do come here remember that they're appreciated. And I don't know, Rick, if you want to share what you talked about at the recovery meeting yesterday morning, but you talked about how, this changed things for years and years and years to come, this negative PR that we're dealing with. So, we talked at the chamber about, on the day that the quarantine and or testing, that on the day that people feel like they're being welcomed here again, just doing a massive social media, all of us dropping the same message and sharing it across all of our social media platforms to say, we can't wait to see you. I mean, we have to be very, very proactive to fight this negative PR. And I know the governor believes that she's doing the right thing, but the testing of the quarantine requirement is just, it's just stop. No one can come here. It's too difficult. No one can get a test. And they're making their plans now for 4th of July. I talked to an innkeeper yesterday for half an hour, and she's like, I know that you can't change anything, but I just need to talk to somebody because today is 2 weeks before the 4th of July. And I'm telling people, believe me, you trust me, you're going to be able to get a test, but they're not going to come here if they don't know they can get it tested. You heard Eric saying, they're doing all the right things. Not Eric, but this government is doing all the right things to try to get the testing in place. But somebody's planning on come here with their 3 kids and spending a ton of money to stay here for a week is not going to take a chance that there's going to be a test when they get here. And then there's no summer vacation. And then 3 kids are like, why can't we have a summer vacation, Dad, Mom? Like, what do you mean we have to go back home? So it's very tough. And so I think as a community, as you said, Buzzy, we're a very resilient community. We can rise above this, and the more positivity we can bring to welcome our guests back, the better we'll all be for it. There's only so much we can do, but we can try our best.
Rick.
Thank you. Yeah, it's funny. I had to go for had to go across the line for a essential function yesterday, just to make that very clear. And as I drove into New Hampshire, there's a big sign that said, if you're staying, you need to quarantine. If you're staying, you need to quarantine. And it was flashing just like it does here when you enter Maine. So I find it really, I find it annoying that people are yelling at Maine for saying you need to quarantine and this is so unfriendly, so unwelcome. But yet it's the same thing in New Hampshire, and I'm sure it's the same thing when you drive into Massachusetts as well. So it's just that we're not used to having to say that here, so people see it and are offended by it. And I want to make it really clear to people who are watching and listening that it's not the select board's decision to close the state. It's not the COVID task force decision to close the state. It's our governor. And yes, we are doing work. We are working with the chamber. We are working with the different hospitality organizations and sending letters to the governor and saying that this is very challenging and this is hurting us economically. So it's not like we're just sitting here like bumps on a log waiting for something to happen. We're being proactive. And so all of you who are upset, why don't you send a letter to the governor as well? Don't rely on, we're happy to do it because we're doing it because it's our business and we want you to come here. But, you could probably just send an email or a letter to the governor as well. And hey, she's going to read yours just as easily as she's going to read ours. So thanks.
Thank you, Rick. I appreciate your comments. And anybody got no more hands raised? There's a few chats out there if you want to read those. Mostly comments, not questions. So let's talk about our next meeting. I am proposing, based on our conversations over the weekend, which were within the rules, because we can discuss scheduling as a group. that we would meet on July 1st, our next meeting. Does anyone have an issue with that? No? Okay, there are no issues with July 1st, so we all get to take 2 weeks to think about what we can do to make us safe and make us also viable. Rebecca.
That happens to be Canada Day, so we can celebrate that too.
All right.
Are you sending everyone here?
I don't think you want Quebec, quite honestly. You can have Maritimes.
I just want to comment on Rick talking about what you said, Rick. I think you encapsulated everything very well. And that if people are listening, that it would behoove you to write your governor, to write your legislatures, and whether it's your local congressmen, your senators, and to say, is there anything that can be done about the 14-day quarantine? The way it's structured now, and even with the testing, it's not practical. It's just not going to work. I've heard people in Massachusetts, I have family down there who say they can't get a test without, symptoms or this or that. All these quote tests that are around aren't around. So, I think, political campaigns are one thing, but I think public outcry, we've seen protests, unfortunately, all over the country, and change has happened. I'm not saying that anybody should do that, but I am saying that if you feel strongly about stuff, write to your congressman locally, write to your senators locally here, and the governor to say, it's not working. So that's all.
Okay, Charlie.
Yes, I'd like to just reiterate what a couple of people have already said. Buzzy and Rick said so eloquently, and I'm thinking, in light of the information that I heard today about face coverings, and I'm really glad that we're going to require them on the marginal way. But I was thinking that we could, and I like the idea of maybe some slogans, as Buzzy's brought up a couple of times. Something about maybe a big flashing sign as they come in. Ogunquit really cares about you. Something like, so please wear a face mask. So you meaning general you, me. So in other words, if people walked around with face masks on when they couldn't social distance, which is what really is suggested, then I don't think we would have to worry throughout the summer, even with the hotels full. So I would like to see something like that maybe in a sign coming in. We welcome you. We really care about you. Please wear a face mask when 6 feet isn't. Maybe shorten it somehow. That we would like them to wear a face. People visiting us to wear a face mask for their own safety, but mostly for others. And that's the cavalier part of it that scares me, is those people walking around, they can't social distance, and almost like they're not aware of the fact that they can give it to others. So that's of concern to me. So anyway, I do want to see us as welcoming, but as Buzzy said, I mean, this is just a whole different time, and unfortunately, we're going to take a hit from it. And I hate to see it, because a lot of the business people in town are friends. So I hate to see that happen, but it is what it is. So that's my comment for the day. Thank you.
Terry Ann, last comment. We're past our hour and a half.
So, this is so obvious, but I just want to say it one more time. This is all about a virus that we continue to see. Although we're doing well here in Maine, we can we continue to see surges, no flattening of the curve, and we aren't even talking about a second wave. And I am so grateful that I'm not the person who has to weigh, are we going to keep people safe, and how can we do that and support our economy, given that we have a tourist economy? And I just want us all to remember how many people have died from this disease and will continue to die, and that it is incumbent upon all of us to try to stay as safe as we can. But I certainly have great empathy, not only for businesses, but for people who have stayed inside and not gone out into public, and the decision makers, including the select board, but the governor, who has to weigh this and make the decisions that are that her team believes are in the best interests of the state. I do not envy her at all. I think it's, you know, there's no good answer, and there's no way away from it without suffering. So I just want to remind us all that this is about the public's health. And if we can't assure public safety, then there's no way our businesses are going to be able to recover. So with that, I'm out. Bye.
Okay, thank you. Do I have a motion to adjourn until July 1st, Canada Day? Hopefully a Canadian will, no, you're not a Canadian, you got a US passport. Hopefully a resident of Canada will give us a motion to adjourn until Canada Day. Rebecca moves to adjourn until Canada Day.
Second.
And Buzzy seconds. And all those in favor, say aye. Thank you for your service to the town. We'll see you on July 1st. Unless something comes up, you may hear from me. Thank you.
Thank you.